Hello, and welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Hey, everybody, welcome back to the Surgical Assistant Podcast, the podcast by surgical assistants for surgical assistants. Today, I'm turning the microphone around and interviewing my co-host, Kelly, as she recaps her experience at the recent NSAA/NSAA conference in Atlanta, Georgia. She'll be sharing fresh takeaways, clinical pearls, and what this meeting means for our profession moving forward. So, hello, Kelly. How are you?
Hello, John. I'm well. If anyone's watching this, I look a little haggard. I think I did drive home from the conference today, but I was lucky that it was in Atlanta. So it was just up the interstate from where I live, about 5.5 hour drive. And I'm working a little bit of a sinus infection. So pardon my stuffy nose voice, but we are here and I'm excited coming fresh off the conference. We wanted to get this recorded right away. And I want to say right off the bat how much we missed you. And I missed having my sidekick there with me at the conference. And several people relayed to me that they missed you being there. So I know you had some time off constraints and some limitations that you're dealing with, but we did miss you being there. And you're going to glean from this conversation as well.
Oh, yeah. Thanks. That's sweet for saying it. I'm sorry you're not feeling well.
No,
And I know you made the drive back today, so I appreciate you taking the time to do this interview while you're still fresh. So, and yeah, I do wish I could have been there. I was bummed that I couldn't be there, but it was just plans had changed midstream. So I unfortunately, but I will be going to the Maddox conference. We're leaving Saturday for Vegas, and it'll be 4 days, and then I'll be back, and we can do a conference recap over that. So if you
absolutely.
want, if you're interested in it.
Yes.
But
Yeah. Well, no, we'll look forward to hearing about that. And just I want to say too, just cluing our listeners into what that is, what is conference, and you're going to fill us in on all that, and we'll formulate a good podcast recap for that as well when you get back.
I definitely will. How was the turnout at the conference?
Well, it was fantastic. It was really record numbers. It ended up being a SYLK conference this year. So they said that the number in attendance was 173.
173? Oh my God, that's crazy. That's
173,
awesome.
which I think is, yeah, it's it's sold out. I mean, that's not
That's the
including the
first one
vendors.
I've heard of selling out since I've been going to them, really.
Right. And they said that wasn't so with the vendors and everybody that was there, it was over 200 people in attendance. So it was really a great energy was happening at this conference for both organizations to come together and do this conference is just a really big bonus, in my opinion, professionally. And the networking is just amazing. And I can't wait to tell you and our listeners about some of the people that I met at this conference and some of the cool experiences that I had and what my idea was for this. And we were talking about how we were going to do this recap episode. But, as I went through the conference, I kind of came to the conclusion that I needed to, again, just appeal to our listeners that maybe have never been to a conference. If you are in school as a first assistant right now, if you're studying to be a first assistant, or if you've been a first assistant for a while and you've never attended one of these conferences, I really want to talk to you. And I felt like, maybe I should start from the beginning and just kind of give a rundown of the flow of how a conference goes, what happens, what takes place. They're all formatted pretty much the same every year. So I felt like that was a good place to start. And if you have any questions, think of anything, obviously, shoot those in and I'll answer them. Okay.
I will. Did you do any pre-conference workshops?
Well, I did. And along those lines, there were fewer pre-conference workshops this year than normal. So before I get too ahead of that, I'm going to stick a bookmark in that point right there because I'll just go ahead and start. Like when we have conferences, they try to, or no, they don't try to, they do schedule the conferences for Friday evening and all day Saturday. So they do this so that we don't have to take much PTO. If you have to take any time off, you really don't have to take a whole lot of time off because the conference, the body, the main part of the conference takes place all day on a Saturday. It's a bonus if you can be there on Friday because typically we do have what we call pre-conference workshops on Friday, and they tend to do morning sessions and afternoon sessions, right? And some of my favorites in the past that I've attended have been the casting and splinting workshop, because I don't do and haven't over my career done a lot of ortho. I really like to attend a casting and splinting workshop. I mean, it just reminds me of and brings me up to date on how we're applying these principles. It reminds me of the principles of applying casting and splinting, as you would imagine it does. We've had ortho like Mako workshops, Mako robotic workshops, played around with ultrasounds, new ultrasounds, finding the radial arteries. We've even had a virtual gallbladder removal where you're trying to remove a gallbladder on a virtual machine. So there's all kinds of workshops. Well, this year I know in the afternoon on Friday, and it was being given by a plastic surgeon and his wife, who was a first assistant. And so I did go ahead and sign up for that. The cost was minimal at $50. It was
Oh,
very
good.
affordable to do that. And so along those lines, when you sign up for a pre-conference workshop, that is an additional cost typically, but it's laid out right in front of you. You can know what you're spending there. You decide if it's a value for you to do it. So I did go ahead and sign up for that. Now, in the meantime, I signed up for the afternoon session because I knew I would not be getting in until late Thursday night. So, and along those lines, then after I signed up for that afternoon workshop, another workshop came available that was about stapling technologies. And it described they were going to go through the history of stapling, surgical stapling devices, um,
Mm,
and these different, and then all the way up to new modern innovations with staplers. And I really wanted to go to that one because and since the inception of this podcast, we have had the idea to do a podcast episode on stapling technologies. So for
mm,
that reason, I really wanted to get into that one, but it was limited attendance. I had already signed up for the wound closure one, so I didn't think I was going to be able to do that one. Now, what I did when I got there on Friday, typically on Friday morning around 11 a.m., registration opens for the conference. So
mhm,
you typically, when you get to the hotel, you can kind of see when you go towards anywhere the conference room area is at the hotel, you
mhm,
see all the ASA NSAA activity, right? You see a table set up and you see the registration table. It's very easy to locate generally. So I went ahead and got registered. Just went up, told them my name. They give you a name tag, your name tag to wear on your lanyard around your neck. They give you a bag with some goodies in it, and then also you have that bag throughout the conference, and you go around to the vendor tables and pick up all the little gadgets. I love to collect pins at the conferences, and there's all kind of fun things to get at the vendor tables.
mhm,
So I registered, and I actually I saw the room where the stapling technologies class was gonna be taking place, and I stepped in there to ask those guys. They ended up being with Medtronic Covidien, so it was
mhm,
Medtronic Covidien staplers, okay? It wasn't Ethicon or Johnson& and Johnson is Ethicon. So I kind of stepped in there and said, "Hey," I said, "I really wanted to come to this. I wasn't able to get into this class. I'd already signed up for the wound closure class." And I was starting to ask them, were they going to have a vendor table in the vendor hall so I could just talk to them later
mhm,
about everything? And he's like, "Oh yeah, we've got spots. We've got spots open. We've got like 6 spots open. Do you want to be in here?" And
mm,
I said, "Well, yeah, if I can work it out." And so of course it was not, they adjusted where my CEs came from for it. I hated the wound closure workshop because I feel like, gosh, we can always improve in that area. But I really felt strongly that I wanted to be in this one, and this is one I really did not wanna be texting you a lot about because the way about surgical history, you would have been.
oh, yeah,
I mean, this rep had on eBay, John, he had staplers there from the 40s, from the 1940s.
mhm,
I mean, it was
okay,
just crazy, and I do have a lot of pictures that I will send to you. But anyway, that was ended up sitting in there
okay,
and going through that, and it was really interesting, just to say the least. It was very
excellent,
enriching. And I want to give a shout out right here to Will from Colorado and Janelle from Powder Springs, Georgia. They were sitting next to me in that workshop, and Will spoke up and said, when I was chatting as usual, I know y'all can't imagine that I'm chatty and I like to talk, but Will said, "Hey," he said, "your voice sounds familiar. Are you on the podcast?" And so he had recognized my voice from the podcast, and how cool that is to meet somebody. And he went on to tell me that he was at that conference because of us talking, hearing us talk about conferences and how great they are. So, and Janelle, same way. Janelle is a kind of a newer first assistant, the same thing. So she received encouragement from our podcast and how we are just talk them up. So how great and encouraging it is in turn for us to hear about that, right?
That is
And
great to hear. Yes.
and Janelle is just doing great things there in Georgia as a first assistant, and Will is killing it out there in Colorado. He's actually
Great.
independent, and I really enjoyed talking to him about what he's got going on. So I want to say hey to both of those guys, and it was great meeting you at the conference.
Great.
But yeah, so I did go to that workshop, and then after that,
Mhm.
on Friday evening is when typically around 5:30, things kinda kick off with the state of the association. They call the association where leaders from each organization will get up and kind of give a financial report, kind of rundown of their individual associations. For those that don't know, we are still working towards converging both organizations of the NSAA and the ASA. We are going to be under one umbrella organization called the American Academy of Surgical Assistants. So
Mm.
is still moving that direction. Things are looking great there. They announced that last year with a 5-year timeline. They do not think it's going to be that long at all until that's complete.
Mm.
Um, but for now, we are
Oh, good.
giving separate business reports. So, and that's not too long. They don't linger too long. They introduce the board for each organization, the presidents, the vice presidents, they address everyone, and everything was really positive. And that's where they announced that this conference was sold out,
Oh, good.
and how excited we were. Both organizations have grown in membership. Finances were good, so all that. So we go over all that. Did you wanna
Good.
ask anything here? How
Sure. Who
did
gave the keynote? Who was the keynote speaker, and what did they talk
Yeah.
about?
Yeah, so I'm glad you asked. That's after
Mhm.
this. So we do the
Mm.
business stuff. When the business stuff is out of the way, tonight we have a keynote speaker, right? So this was a nurse practitioner she was the vice president of the procedural area at Emory St. Joe's Hospital,
Mm.
and she gave a very encouraging and inspiring talk about the power of the surgical team, setting a standard of excellence in the operating room, and how we anticipate complications as we're working as a team. We're
Mhm.
shaping what surgery looks like for the next generation. She encouraged us in how do you show up? How do you speak up? How do you keep growing as individual professionals? She encouraged us to seek challenging cases, to seek surgeons who push you, opportunities for growth,
Mhm.
mentor others, speak up in institutional settings, advocate for your profession. So really, she spoke to a lot of the things that you and I believe in. Those are our part of
No,
our core
exactly. Yeah.
values. We're passionate about what we do. We want to hold that standard of excellence. And she was a very encouraging and inspiring speaker. Just great to hear from her, very professional, and she's doing great things there at Emory St. Joe's. So after that,
Mhm.
after the keynote speaker, then it's time to go out and have the reception. So there's typically good hot hors d'oeuvre type food, light bites. There was an open bar, and it's just a time of mingling and kind of fellowshipping with one another and
Mm.
seeing people from you haven't seen in a year, maybe with people that you know. Um, and so it's just a really fun time to get together with fellow professionals, and that wraps up the Friday kind of the conference. So,
Good.
and that's always a fun. I mean, it's really a fun time. You just meet other people, and there was again, I'll say it again, there was just a really good energy at this conference that I was really appreciating for sure.
Oh,
just a
that's wonderful.
camaraderie, just a real camaraderie among fellow professionals. So that you just kind of
Mhm.
that goes kind of late. I guess some people, if you're in a city that you've never been in before and you want to go out and do something else, of course, obviously you're free to do that. Um, but the next day, I like to sit and really experience the speakers through the day on Saturday. So I like to kind of make it an early night on Friday night
Mhm.
and get my rest because I like to get up on Saturday and be ready to go for that full day. I did venture into I kind of peeked and ventured into the vendor hall. We call it the vendor hall. It's the room, all the vendors that are there set up, and kind of peek through there. There's always a kind of a raffle that we do at the conferences. They card with all of the vendors on there. And as you visit each table, the vendor will stamp your card that you've been to that table. And once your card is filled, you you put it in a box at the registration table, and they give away a $500 gift card, credit card at the end of the conference. You have to be present to win. So that's always a kind of a little fun thing to do. It
Yeah.
encourages you to get to all of the tables, and there's always good reps are there, and you always get good information. I got some really, um,
Mhm.
I'll talk about the products and things that I saw in the vendor hall a little bit later. But yeah, so that's always a fun thing. So I like to kind of
Yeah.
before I hit the hay Friday night, I like to zip through the vendor hall and see who's there and kind of speak and see who's in there. So
Any products at the vendor hall stand out to you that,
yes, yeah, and I wanna talk about that. Well, actually, I can just go ahead and talk about it now. There was a new stapler, a new endo linear stapler that was there, and
mm,
I'm not gonna have the exact names in front of me, but there was a new dressing kind of a dressing, like a mesh dressing tape to use over incision sites in place of skin glue.
mm,
And the pitch there is that up to 20% of patients have skin reactions to skin glue. And so it was called SYLK, SYLK, if anybody wants to look it up, SYLK.
okay.
And it's like a mesh, real flexible dressing to put over. It stays clean. You can shower. Uh, the patient can shower after. Excuse me, I'm sorry about that. Um, can shower with it on and whatnot. So that was kind of cool. There were a few surgical assisting groups represented there in the vendor hall.
Mm,
The All-Star Surgical Assistants had a table
mhm.
there that we interviewed them.
Oh,
They
good.
had us set up there, yep, to answer questions, and it was a good vendor experience this year. Um, and I was glad I went. So, came home with a couple samples of that silk dressing, not that I mean, it
Mhm.
says not for patient use. Obviously, we're not gonna use them on anybody, but I'm gonna show it to my docs and see if it'd be
Right.
something they'd be interested in looking at.
Yeah, definitely. Were there any
So
changes to the, scheduled, scientific talks that they had? Like, did it still start off with the surgical correction of complex deformities with Dr. Terrell?
yes, it did, and when I tell you that was one of the most talks it was fantastic. I mean, he was from right there in Georgia, and I will say a lot of the times, I think most of the time they do try to get local surgeons to come wherever the conference is being held, local surgeons are there speaking. So, yeah, Dr. William Terrell is at Pinnacle Orthopedics in Marietta, and he spoke to us about complex deformities and correcting really significant deformities of all types. And he showed us fabulous video and photos of before, during, and after, patients that he's had, and some of the extreme things that he's done. I mean, it's really like watching modern day Miracle, in my opinion. I mean, to
Mhm.
see people whose feet are so disfigured, both feet are just so disfigured and curled up, um, to see him take that and straighten them completely out where
Mhm.
they can walk like a normal person is just it's truly unbelievable to me and
Mhm.
so inspiring the talent and skill that he has. One of the most interesting things that I learned during his talk was that I guess if you wanna call it a cosmetic procedure, but he's actually made someone taller by lengthening their femur just because it wasn't It wasn't a dwarf or
Mhm.
it wasn't anyone with dwarfism or anything like that. It was just someone that wanted to be taller, and that's even a thing. Like,
Yeah.
I really have never heard of that and never even thought about it, but the fact that he showed us the X-ray pictures and how he goes through the procedure, and so it when it just to hear these surgeons give us so
Mhm.
much information and just, opens your world kind of like, "Oh, wow, I didn't know that
Yeah.
was even going on anywhere."
Did he talk about what system he uses for his distraction osteogenesis?
He probably did, John, and I did
Oh, okay.
not write it down.
Do you
He may have said
tailor
it.
spatial frame or something like that maybe, or there's
It
a
was a
several
lot,
companies that make one, yeah.
yeah, yeah. My question at the end, and a lot of all these speakers give us opportunities to ask questions at the end, and I actually for him, I wanted to know, was this an official subspecialty of orthopedics, and did he
Mhm.
have fellows? He said that there was I think it's called LLRS, and I wrote this down real quick, limb lengthening. I feel like I'm missing a word, but it has something limb lengthening society. There's a
Mm.
limb it has something to do with limb I'm sure if you Google limb lengthening society, and then I think he said it's LLRS, but I don't know what the second L would be for. And again, it's down very quickly, but that there is a specific society for this subspecialty of orthopedics, and that
Mm.
he did not have any fellows currently, but he would be open to have fellows, is what he told me. So I was like, "Okay."
Oh,
He's
wow.
been doing it for a while. He's a seasoned surgeon and obviously excellent at what he does based on a lot of the video and photos that we saw. I mean, it was very inspiring, and I learned a ton just listening to him. Next, there was I think I was out in I did skip the second one, I'm gonna confess. It was minimally invasive spine,
Okay.
and yours truly is just not doing a whole lot of spine surgery these days, and I did after his talk, we had a break, and during a break,
Mhm.
obviously, you can go out and get coffee, whatever you want, and a restroom break, whatever, and I went into the vendor hall, and I did get kind of sucked in over there, and was talking to some people in the vendor hall. So, and then the talk started with the spine surgeon, and I just stayed in the vendor hall during that second talk. So, I normally don't do that, but I knew that
Mhm.
that was one. If I was going to sacrifice one talk, I was going to sacrifice that one. But
Okay.
the next surgeon was talking about minimally invasive spine surgery and new innovations there. After that I loved the name of this one. It was Doctor Tara Paul Olson. She was
Oh, yeah.
She was delightful, and the
Is it
title of her
funny?
talk was Butts and Guts, Overview of
Mhm.
Colorectal Surgery. So, I really enjoyed
That's cool.
her energy too. She had a great personality, and I kept thinking, "I bet she's really fun to work with." Did a great job of just going over, John. She ran down anatomical basics of the digestive system, the anatomy. So she went through and told us, of course, terminology is important when you're talking about the colon and small bowel and
Mhm.
how
Yep.
sectionally you're going through those. Speaking of starting at the terminal ileum and,
Mhm.
the segment for the cecum, the ascending or right colon, the transverse. She went through all that. A lot of the basic anatomy with us, right? She talked about the blood supply, how the vasculature of the colon impacts the type and extent of the resection. She
Mhm.
talked about some of the important landmark nerves that are there, the blood supply specific to the rectum. And then
Mhm.
she went through all that basic anatomy with us and then went into common diseases of the colon, talked about diverticular disease, the management of that, medical management and surgical management, considerations. When she got into the surgical part, she talked about considerations. For instance, where are the ureters, anatomical landmarks and landmines, as I like to say.
Mhm.
Um, she talked about inflammatory bowel disease of the small bowel.
Mhm.
So common and conditions that affect the small bowel and the colon. She went through all that with us, and
Oh, great.
she got down to the talking about low anterior resection versus abdominoperineal repair, I mean,
Mhm.
resection. And she says we were getting down there to the end, to the essentially the anus and rectum. She'd gone from the top and gone through all these things in steps. And she says that one of the funny things she says, "We come for the guts, but stay for the butts."
Okay,
So
that's funny.
she was really funny. Um, but yeah, so we went through those, and it was great to be reminded of everything that she was talking about in those big procedures. She was just really, and she took questions as well, and
Mhm.
she was just a great speaker, very articulate and easy to understand. And again, she just had a really cool personality. We probably had a
Awesome.
break again,
Mhm.
so we
It's always
broke
good
after her.
when the presenter is funny and engaging like that. You always tend to learn a lot.
Yes.
Does she use the robot a lot in her practice?
She uses all yes,
Okay.
she's very robotic dynamic, yeah.
Okay.
Somebody had a question to her about hand assisted laparoscopic. She addressed that and said that's a perfectly good way to do it. She said when she started her training, she was coming in on the tail end of the laparoscopic, hand assist laparoscopic era, and they were moving more into the robotic platform, but she's a big robot user and she seems to be an expert in her field, certainly. Um, I remember I just kept thinking, gosh, I bet she's
Mhm.
fun to work with. I bet she's really great to work with. So when you're listening
I
to
bet.
a speaker like that, it's really entertaining and just fun to hear her talk.
Yep.
You get reminded of some of the basics that you need to be
Mhm.
reminded of and things that you already know, but it's good to hear again. Good to hear a different surgeon talk about doing things maybe a little different than surgeons that you work with. And I just want to emphasize how enriching it is to
Oh,
our
definitely.
brains, and just it kind of wakes up parts of your brains. Easy to get into a routine and how your surgeons do it, and not that anything's wrong or bad about the way we're doing it, but to hear
Mhm.
a different spin on it and a different surgeon's perspective is it's good for us to do that.
Exactly, and people in a more rural area may think, "Well, that doesn't apply to me. We don't have a robot or we don't have a surgeon that does that. We do everything open or whatever," but new surgeons come all the time, and
That's true.
forewarned is forearmed. I think if you know this ahead of time and you're at least familiar with it, then, that gives you one leg up. Maybe it won't be as intimidating as a case. You'll know the steps
That's right.
because I'm really
That's right.
pushing with
And just to hear her perspective on and just be reminded because these are surgeons that are talking to you, so they're certainly talking to you from their perspective, like what they're thinking when they're doing the surgery, what they're watching out for, what they're worried about, what they need from you as the assistant. And these surgeons, I do want to say that all of them across the board emphasize, and really I appreciated the way that they speak. They know their audience, their first assistants, and they are sure to explain how vital a good first assistant, having that good bedside
Mhm.
assistant at the in the case, especially a robotic case, is. And so,
Yes.
and just for them to say little things like, it's helpful when my assistant does this. It's not helpful when they do this, or is key. Again, a lot of
Mhm.
I already know, but she might say something that I didn't think of. And so that you will
Mhm.
take something, I promise, away from these conferences. You will take it back to your environment and where you're working and your team, and you will take something helpful away. I promise. I can
Exactly,
promise you that.
exactly.
So then we heard from Dr. Eric Velasquez, and he is a bariatric surgeon, and he spoke specifically about the duodenal switch
Mhm.
operation, which is the gold standard apparently in bariatric surgery. He called it the best bariatric surgery for its metabolic effect. Um, it
Interesting. Did
does
he talk
involve a
about
sleep
Sorry to
gastrectomy.
interrupt. Did he talk about the single anastomosis duodenal switch, or did he speak of the duodenal switch in
He
general?
towards the end, he did talk about the SADI,
Okay.
and that is the single anastomosis. He does not do that as much.
Mhm.
He explained why. Someone asked a question at the end about that, and he did address
Okay.
it, John, but primarily the classic duodenal switch. He talked about, I mean, and they go into details about telling us how many centimeters back from the ileocecal valve they
Oh, it
go.
has to
And
be, yeah.
again, then I'm not gonna go into every detail here about that specific surgery. Maybe we'll do a bariatric surgery episode,
Mhm.
as well.
Oh, definitely.
But just talking about those, because that is such a huge
Mhm.
robotic surgery these days. Um, But just talking about the positioning and how important positioning and considering port placement,
Mhm.
bowel measurement, Dr. Velasquez was really, really speaking highly of his first assistant and
Oh, okay.
how they don't even have to talk. That first
Mhm.
assistant of his knows what he's doing. She knows the procedure, knows what he's thinking, what he's going to do, is communicating with the room. He really
Mhm.
emphasized how important it was to him that the first assistant was communicating with anesthesia, what they were going to need to do
Right.
with the bed, what was going to be coming next, how they were communicating with the CST and getting them ready to have this stitch ready, and
Mhm.
just really that first assistant is kind of running things and communicating with, not running things per se. I didn't really mean to put it like that, but just really so involved. He's at the console, right? He's at the console. He's
Right.
in the patient's abdomen. The assistant is in the room and can see what's going on at the bed. We
Yep.
all know this. We see what's going on with the arms.
Right.
Um, we see what anesthesia is dealing with, and so we are that. And he really just was
Mhm.
very emphatic about how vital a good first assistant is in these cases, and how and it just it
Sure.
encourages you as a first assistant. You
Yep.
you receive a lot of encouragement.
Definitely. Yeah, in cases like that, you need to give anesthesia the heads up to make sure that they have the
Mhm.
icy green so that when the doctor asks for it, "Okay, can you give the icy green?" "Oh, I don't have it." I usually ask them ahead of
Yeah.
time, "Hey, do you have the icy green? We're gonna need that in a few minutes," and then that gives them the time to find it, so that's great. How about the next one after that on plastic surgery or plastic surgery techniques, rather?
So that one was really good. Dr. Cameron Abomali, probably slaughtered his name. I'm sorry about that. North Atlanta Plastic Surgery is where he came from. He was a great speaker as well. He really honed in on wound closure. So
Ah,
this is where I felt like I kind of got a little redemption from not being in the wound closure workshop. But he was talking the goals of his talk, and I like how he gave us goals of his talk at the beginning. He
mhm,
said the goals of this talk is we're going to review wound healing principles, um, fundamentals of tissue handling, discuss layered wound closure, and suture selection. So
mm,
again, as a first assistant, these are really important things, John, that we need to. And okay. Maybe I'm the only one. Maybe I'm the only one that's been doing this as long as I have. And you go through and you do case after case after case, and we get in the drudgery of working, of just getting caught up in working, and sometimes it's easy to forget what we need to be focusing on. And, oh,
mm,
let me think about this. Let me think again about how do wounds heal, the stages of wound healing, and why is it important that I select certain sutures? Now, hey, many times our surgeons are telling us what to use. In
mm,
that case, obviously, if you have a good, valid argument, by all means, bring it up with your surgeon, especially if you have any concerns. But we need to not be robots. We need to be critically
mhm,
thinking about our patient and their specific condition and the specific wound that we're looking at. What has happened in that wound? Has it been infected? Is there a lot of tension? How much tension is on it in our suture selection? So, again, just a very good and enriching talk
yep,
about looking at our incisions and how to best optimize the closure of our wounds. So that was again a very good talk from him. Um, and then the neurosurgeon, oh my goodness, Dr. St. Aaron Morris, he was speaking about operative considerations for the neurosurgical patient. He's a prior
okay,
Air Force. He was a prior Air Force neurosurgeon. This
okay,
guy, first of all, it was so far over my head, so to speak, because he was talking about so much cranial surgery and cranial
mm,
nerves and
mm,
parietal this. And but I was mesmerized by just the knowledge that these and the knowledge and the skill that these physicians have. It just
oh, yeah,
be so dramatic, but I just am in awe of what they do. And I really, I'm not a neurosurgeon, a neurosurgery expert, by any means. I mean, I would say
mm,
cranial surgery is the least of my experience, very by a lot.
But that's why
Um,
these conferences are so beneficial
hey,
because you have
hard.
your weaknesses, you know what your weaknesses are, and personally, I just look at it this way, we should always struggle to improve, and if we need to know where our weaknesses are so that when a conference like this comes along and a specific presentation like this, that's your time to ask questions and learn from somebody because it's such a highly specialized area. And there's
Right.
even subspecialties in neurosurgery, like pediatric neurosurgery, and then you have cancer, Parkinson's, all the different things,
Yeah.
deep brain stimulators, as opposed to just your bread and butter like VP shunt, craniotomy for burr
Mm.
holes for a subdural, more than that. And that's why I think these are so beneficial. So I'm
So,
glad.
so yeah. And so on one hand, I'm like, oh my gosh, like I feel like a dummy. And then on the other
Yeah,
hand, I'm like, let me just soak everything in that he's saying. Like, let me be of some of those nerves. He was talking about how vascular the scalp is, which of course I know, but then he was like going over the superficial vascularization in the
mhm,
scalp and how he avoids some of the main in his incisions, how he avoids
yes,
those cutaneous vessels and nerves with his incision type and what he's thinking. Again, just kind of getting a little glimpse into the surgeon's mind about what they're thinking in their surgical technique and their surgical approach. Um, so, yes, John, you're exactly right. I mean, just being reminded of even if it's reminded of medical or anatomical terminology
sure.
in the head. They talked about showing us again, like showing us really good CT scans and of the brain and talking Chiari malformation, and
Oh,
how and that
exactly. Yep.
surgery and asking anybody, "Do you recognize this condition?" And just it was interactive. It was an interactive
Mhm.
talk, and again, just kind of overwhelming with how
Yep.
much exposure you get to new and different things that, yeah, I am not getting at the hospital that I'm at, which is fine. But you're exactly right. This
Sure.
is why we make it a point to invest in these conferences and go to these
Mhm.
conferences. Unfortunately, the last speaker that came was there. He was another bariatric, Dr. Ahad Khan. He
Of
had
course.
gotten caught in traffic. He was running a little late getting
Oh,
there because he had got caught up
Atlanta
in
bad
surgery.
traffic in
Oh,
Atlanta? Or
imagine.
really? No
But he had
way.
gotten delayed in I think, an unexpected surgery, and so then it made him late even heading to the venue, and then he was in, yeah, unexpected bad even unexpected for Atlanta, bad traffic. So, his was really quick. He was talking about bariatric surgery, and he again, just the video on the we had technical
Mhm.
difficulties, but he was again just very to end the day, was very funny and just had a great personality again, so but talking and one thing I took was he was talking about efficiency in robotic surgery and how
Alright.
proficiency and frugality and how the hospital looks at all those numbers and he really aims to be as frugal and proficient as he can in his surgeries,
Mm.
um, and just keeping those kind of things in mind as far as room setup and whatnot. And then after that, the end of the conference and the speakers have
Mhm.
wrapped up, typically is then when we have our roundtable discussion with the organizations. They really had done a lot of behind the scenes. I think they were doing a lot of behind the scenes talks and having their meeting during these conferences, during the talks on Saturday, and they gave the update on the convergence of the 2
Mhm.
organizations, and a couple people asked questions but there wasn't any big revelations or anything. I mean, we're still making headway on legislation in Ohio and just going forward with that. But again, it takes everybody's support. It takes a strong membership to do that. And so they had a little Q&A session and we wrapped it up. And after that, we're kind of just we did some more milling about and networking after that. And then you're kind of done. It's at like I don't know, I wanna say 5:30, 6 o'clock in the
Mhm.
evening. So, again, that leaves the evening open that you can go to dinner with friends that you've made, people that you know. You can just kinda have the evening to yourself, which is kinda nice,
Mhm.
just kinda be on your own free time. And then oh, and I think I forgot to say hey to Carl. I wanted to give Carl Petty a shout out
Mm.
too in San Diego. We met him last year, and I was gonna say he flew out. See, he chose to fly out in the evening on Saturday, so he had to leave just a little bit
Right.
early from the conference to get his plane. He was gonna head home. But hey, Carl, I just wanted to say, hey, it was good to see you again and talk to him. So yeah, then you have a choice to mingle again and kind of do what you want in the evening. So I chose to stay
It's
in
great.
because I was in Atlanta and I
Mhm.
don't want to go anywhere in Atlanta. So I think there was a baseball game
True.
going on and there was a Cardi B concert. And so I was like, I'm not going to get out in Atlanta tonight. So I just stayed in and kind of
Mm.
rested and
Yeah.
that wrapped it up. Yeah.
Oh, that's wonderful. And yeah, we're at 44 minutes, so we should
Yeah.
probably try to
That's
keep these a
right.
little shorter, take
Mhm.
the feedback that we're getting from people that maybe we should make these a little shorter. So is there
Yeah.
anything overall that stands out to you, the conference, like you walked away thinking
Uh,
like, "Damn, that's like, I'm glad I was there because I learned that," or did you learn something or see something or meet
mm.
somebody or
Well, just yeah, I think just a little bit of all of it, John. It was a
Mhm,
very enriching, encouraging conference. I was really glad to see the energy that was there. I feel like was really good, even probably one of the best conferences as far as I don't know, the vibe or the air. I don't know how you want to say it. I just
mhm,
felt like there was a lot of congeniality, I think is what I want to say between the all of the members of both organizations. Not that there's been any bad blood or anything like that, I'm not saying that, but it's common to know people in your own like, I know people in ASA, and if you're in NSAA, people in NSAA, and a lot of times we don't know each other, so I feel like in past conferences, there's just been a little bit of a hindrance, but this conference, I feel like there was a lot of cross-mingling, so to speak, and it was just a really good energy. I do wanna say that next year's conference they announced is going to be Florida, which I'm really
oh,
excited
good.
about. I'm selfish there because it's very close to my home. But,
Yeah,
yeah, so Tampa, April 16th and 17th of 2027. When that
okay,
registration pops open, we need to be jumping on it because it's gonna be another full one, they think, and,
good.
yeah, don't let it sell out without getting signed up, but, yeah, it was just an overall really great conference. I'm really excited about it.
Great. I'm so jealous that you got to go and I couldn't. I'm bummed that I can't go, but oh yeah, and just to I looked it up while you were talking. The LLRS is the Limb Lengthening and Reconstruction Society, the
Thank you very
ASAMI of
much.
North America. Yep, it began in
Yep,
1989 as the Association to Study and Application of the Method of Ilizarov, North America. So they must use the Ilizarov frame for limb lengthening.
that's it,
It's
John,
which is a heck of a frame if
and
you've
he
never
said
used it
that.
in other
He
orthopedic
said that many
procedures.
times.
It's fun to work with. I love that system. So that's wonderful. I'm so jealous that I didn't go. And that's one thing I love about the ASA NSAA conference is that it's conducive to us working folk as surgical assistants. Because technically, if you want to skip the pre-conference workshops, which I don't suggest because I get so much out of them and I need to keep up with them as a traveler, but it's on a Saturday.
Mhm,
So, and
right,
you like you said, you can fly in on a Friday night and out on a Saturday night if you can do like Carl had to do. Some
that's
people I
right.
know have to do that. I try to get there Thursday night and leave Sunday. It leaves a lot of time for the workshop and other stuff like that, but not everybody has that luxury. But
Right.
if you're close within 10 hours of driving distance, you can easily do that on a Saturday.
Mhm.
You don't have to worry about call or anything. So I think that's the one thing I love the way they do it. The conference I'm going to next week, it's one conference on on a Sunday, a standalone medical disaster operations one, and then there's Monday, Tuesday, and a half day on Wednesday. So that's a significant commitment and a
Right,
significant commitment of time. So our conferences definitely make it more conducive. So
right.
thanks for such a wonderful wrap up. I think that's
Yeah,
fantastic.
yeah. Well,
And
thank you once again for listening. We appreciate you, and I really appreciate everybody that mentioned the podcast at the conference. We just spread the word. I get positive feedback. The only negative, like if you call it negative, constructive, I'll say, gotten really is the length. We do tend to talk, and
yep.
we know that, y'all. We know, and we really do try to keep it under under an hour. I always have a conference with John. I'm like, John, we got to
Yep.
keep this short, and then we both
It
never
never
do.
works out. Yeah.
Listen, just fast forward through the parts you don't wanna hear or
Yep.
just listen to it in 2 parts. Just do that. I
Yep.
do that a lot of time with podcasts I listen to, but we are cognizant. We're trying to be cognizant of it and not be repetitive and not be redundant. We don't wanna do that.
Right.
We wanna continue to bring you relevant information and that is encouraging to you as a first assistant, and I so appreciate, and I know so does John, the positive comments that we've gotten, and I received a lot this weekend, and I really, truly
That's
appreciate it.
wonderful. That's
Yeah.
great.
Yeah.
Yeah, and it's hard sometimes to make this applicable to everybody, from people who don't know anything about surgical assisting to brand new people, people about to go to school, as well as veterans because
Right.
there's vastly different levels of knowledge and skill,
That's
but
true.
we at least try to make it applicable to everybody. And it's a work in progress. We're going to get better. We'll
Mhm.
take your feedback into account and go from there.
Absolutely.
So, yes. Well, thanks, Kelly, so much. That's
Right.
wonderful. I'm looking forward to the next one. I'm definitely looking
Yeah.
forward to the next ASA NSAA conference, and I'll be there for sure.
Yes.
So,
All right. Well, good night,
thanks.
everybody.
Take care. Don't forget to like, comment, and subscribe. Thank you so much. Thank you for joining us today. We invite you to like, comment, and subscribe to our podcast. Feel free to look us up on Facebook at The Surgical Assistant Podcast. If you like, you can also email us at thesurgicalassistantpodcast@gmail.com. We look forward to seeing you on the next episode. Content of this podcast is created for surgical assistants and is educational only. It is not intended to diagnose, treat, or offer medical advice on surgical conditions. No patient-specific information is shared, and all HIPAA guidelines will be adhered to.